Prostate cancer is expected to be diagnosed in over 900,000 men worldwide this year alone. In the United States, there will be more than 200,000 new diagnoses. The majority of patients, over 90%, will be diagnosed with localized or regional disease, and overall, survival approaches 100% at 5 years. That being said, there remains a risk for recurrent disease in patients diagnosed with prostate cancer. The estimated risk may depend upon various clinical factors at the time of diagnosis. This could include the level of the PSA, the extent of disease, and the grade of the tumor as determined by the Gleason score on the biopsy. For example, patients with more extensive disease, higher PSA, and a higher Gleason score diagnosis would have a higher risk for disease recurrence. Patients who have lower PSA, lower Gleason score, localized disease might have a lower risk for recurrent disease. If patients do recur, treatment options would depend upon how they recur. For example, patients with localized disease may be candidates for various salvage approaches with salvage surgery or salvage radiation. For patients who recur with more extensive disease, treatment options might include various systemic therapies, including hormonal therapy.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.